I think it really has to do, in part at least, with elderly seniors, particularly those who don't speak English very well. The city has been helping out with, for instance, this new Shifa clinic that is out in West Houston in the Asian community. It's an amazing facility, and this is a good model. We have put quite a bit of money in that from the resources that we have in the city, but we need to expand that. Part of it also is multilingual public outreach and letting particularly seniors and families know what services are available. That's very important. Some of that can be done through the schools. Some of it can be done through the churches. Some can be done through civic organizations in the Asian community. But I would like to see, again, I don't want to sound like a broken record, but the answer, I believe, is this vastly expanded network of neighborhood health clinics that are located in the areas where the need is the greatest and where people culturally are not used to going to a great big institution like a large hospital or an emergency room to get services.
Being a champion of diversity, it means understanding the rich contributions from the Asian community and the unique challenges associated with the community. And those challenges cannot be ignored by government. You can't take one and not take the other. So we have to have a greater outreach in the community. We have to have more clinics. We have to have culturally appropriate and language appropriate facilities for people. Obviously, the problem is acute with the elderly, but it's a problem that will be with us as we go forward, and we've got to work on it.
You know, as mayor, we have to be concerned with all communities. A minute ago, we talked about the Hispanic community. We're talking about the Asian community, Southeast Asian community, the African American community. As mayor, I have to be responsible for all of them. And we need a plan that will work across the board. One of the ideas I'm looking at is that in all those communities, we have problems with crime. I want to use a plan that Los Angeles is doing, where they go after all the criminals, those gang members, in civil court, and they go and they capture all those dollars wherever they're at, and they give them back to the community. What greater idea could we have than let's help our communities with health and wellness? That's what I will try to do. I will look at other ways to help. We talked about the mentally ill earlier. You know, one day I was out talking to a mentally ill person on South Main, and I saw our firefighters out there collecting money for muscular dystrophy. Why can't we collect it for Houstonians as well for programs like this? That's what I will do as mayor.
You're gonna hear some sameness on this answer, and it's very similar to the last one. We need culturally appropriate outreach into those communities. The particular problem in the Asian community is isolated seniors who don't speak the language and who are not connected to each other. We have the city has invested dollars in senior housing. We have invested dollars in care clinics directed toward the Asian community. We need to continue to do that. In a larger context, we've talked about wanting to put clinics into neighborhoods, and I think most of us up here agree that we need to expand our network of clinics. But if you can't get the clinics to the people, you have to figure out how to get the people to the clinics. And we haven't talked today about mass transit or about being able to move through the city of Houston. I'm particularly concerned that our Metropolitan Transit Authority has been, in my opinion, cannibalizing the bus system in order to feed the light rail system, and that we're increasingly isolating pockets of Houston that have no access to our bus system and no access to mass transit. So they can't get to the care that they need and the basic services that they need. So we're going to have to come up with a plan and how to address that, and I look forward to working on that.
Our next question will be asked by Mr. Henry.